Hello, and welcome to Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Michelle Wargo. We are dedicating this episode to men's health, and we'll be sharing a number of ways to help the guys stay healthy, including what you should know about the most commonly diagnosed cancer and advanced treatments available. A local expert will explain why what you reach for to quench your thirst might not be the best thing to hydrate you. And we'll show you a recipe that uses easy-to-find, healthy ingredients and requires little time in the kitchen. We begin with a topic everyone should be concerned about: skin cancer. It's the most commonly diagnosed cancer in the United States, and no surprise that Florida has one of the highest rates of the disease, because we're constantly exposed to the main cause of the disease, the sun. An estimated 3.5 million skin cancer cases are diagnosed each year, and 1 in 5 Americans is expected to develop skin cancer sometime in his or her life. There are 3 main types of skin cancer, and they all usually appear as scaly, raised patches or open sores or bumps. They often appear on areas most exposed to the sun, such as the nose, ears, legs, and arms. The most dangerous is melanoma, and develops when unrepaired DNA damage caused by ultraviolet radiation triggers genetic defects that cause skin cells to multiply rapidly and form malignant tumors.
We'll look to see, does it have those raised borders? Does it look irregular? Does it seem to be getting larger? Anything that's darker in color, brown, irregular spot, is suspicious for melanoma.
Men are twice as likely as women to die from melanoma. The reason? Men tend to spend more time outdoors than women, working, playing sports, or spending time in the yard. Experts say men are less diligent about applying sunscreen, which helps block dangerous ultraviolet rays that damage skin. And men are less likely to go to the doctor where suspicious marks on their skin could be noticed early on and treated. If caught early on, advancements in treatment offer a variety of options.
While surgery has historically been a mainstay for skin cancers, there are often skin cancers in cosmetically sensitive areas that are better treated with radiation therapy. For patients for whom their skin cancers are small enough to allow for this accelerated treatment, it's really a very easy procedure. They will come in, lie down on the treatment table. The whole process takes about 10 minutes, does not hurt, really has no side effects apart from causing some mild temporary skin reaction.
Dr. Brabham says the daily radiation treatment may last only a couple of weeks for certain types of skin cancer. And doctors stress the best way to avoid skin cancer is to prevent too much sun exposure. Limiting time in the sun and wearing protective clothing when you are outside is important, but it's rarely feasible. So Drs. Brabham and Friedman recommend applying a sunscreen of at least 30. Frequently and liberally, every 2 hours or more if you're swimming or sweating a lot. It is especially important to make sure children are protected with sunscreen because their skin is more sensitive to sunburn. Experts recommend that sunscreen can be applied to children as young as 6 months. If you feel your child is old enough to do it himself, make sure you practice together so he won't miss any areas. Now let's get to the heart of another medical issue that affects millions of Americans. Cardiovascular disease is the #1 killer in the U.S. of both men and women. According to the American Heart Association, about 8.8 million men today have cardiovascular disease. That's about 1 in 3 adult men. Cardiovascular disease can include a number of different concerns: heart defects, stroke, high blood pressure, high cholesterol, and heart failure. Of particular concern for doctors is that men especially put themselves at risk for serious illness.
Men typically wait far later than women do. We frequently pick up male patients on a regular basis that are at a very advanced level of heart disease. That had we picked them up early, we would have been able to perhaps go ahead and do an intervention that would have prevented a heart attack.
Many men actually start to notice signs associated with heart disease, symptoms that truly affect the quality of life, but they don't say anything because they're uncomfortable or afraid of seeing a doctor.
I never really realized that this heart disease kind of sneaks up on you, you know. It's just like your hair growing. All of a sudden you look and all of your hair is too long, but you don't notice it during the time. I used to be an athlete. I was in high school. I was a swimmer, a competitive swimmer, and I stopped all of that and gained weight. And I smoked for about 15 years. I quit in 1980, but that still has a lingering effect. I would get winded, my blood oxygen level would go down.
Lindsay Richards of Tavares, one of Florida Hospital Waterman's first heart center patients, had surgery to open 2 blocked arteries. Now living a much healthier lifestyle, Richards admits his big health scare could have been avoided.
Looking back, I knew something was wrong for years. And there's a natural tendency to say, well, you know, let's worry about it next week. And I think there's a lot of people out there that are like that.
That's where doctors say women play a critical role in the health of the men in their life.
Listen to your wives, listen to your girlfriends, listen to your mother. We would lose many more men if it wasn't because of the women in their lives trying to intercede and make a difference in them getting to an institution.
So now you may be inspired to adopt a healthier lifestyle in order to stay heart healthy. We know a diet filled with fruits, vegetables, lean meats and fish, and whole grains contribute, as well as regular exercise. But exercising in the Florida heat, especially if you're not conditioned for it, can be dangerous. It's important to stay hydrated, but you might think twice before reaching for a so-called sports drink.
When you talk about hydration, water should always be your #1 thing to go to. And it's funny you mentioned sports drinks because there's sports drinks and energy drinks. And those 2 terms should not be used interchangeably because they're completely different. Sports drinks are beverages that have carbohydrates, minerals, and electrolytes and flavor. And their goal is to hydrate or replenish the water that you lost through exercise or physical activity overall. Energy drinks are composed mainly of stimulants, caffeine being the most prominent of them. And caffeine can actually increase your heart rate, increase your blood pressure, and overall long term, it can actually cause more chronic and serious issues.
Residents in Lake County should take heart knowing an important resource for medical care has received national recognition. Recently, Florida Hospital Waterman received an A rating for safety from an independent industry watchdog, the only hospital in Lake County to receive the highest rating. The Leapfrog Safety Score represents the hospital's ability to protect patients from accidents, errors, injuries, and infections. In determining the rating, a panel of experts reviews a hospital's process for avoiding medication errors, whether they have appropriate staff, the procedures for preventing patient falls, as well as the spread of infection. Stopping the spread of infection is especially concerning because you can't necessarily see when a virus or bacteria is being shared with other patients. That's why prevention protocols work best when everyone in the hospital follows them. And there is an important process Florida Hospital Waterman has in place that we should all practice at home, at the office, or at school. Believe it or not, hand hygiene or hand washing is considered the most important way to prevent the spread of infection. The key is your technique and the length of time you spend vigorously rubbing your hands.
I basically just tell people to make sure that you do frequent hand hygiene, and that can be anything that they want to call hand hygiene as long as you're doing the procedure of soap and water. It's not one of those where you just kind of put your hands under the water, take your hands out. It has to be at least 15 seconds.
Stallcup says alcohol-based hand sanitizers can be effective at getting rid of 99% of the bacteria and germs on your hands and may be a good alternative when you need a quick cleaning. But she says hand washing is still the preferred method. There's more to come after the break on Waterman Wellness. A local expert will demonstrate what adult children should be on the lookout for in their elderly parents' homes. We'll visit the Conry Creation Health Center to show you a summer recipe that requires little time in your kitchen. And a Lake County doctor will explain why just a few seconds can save a man's life. These stories and more are coming up in a few moments. But first, Waterman Wellness wants you to know about some upcoming events, classes, and seminars that can help you stay on the path to wellness. Stay tuned. Welcome back to Waterman Wellness, your path to healthy living with help from local experts. I'm Michelle Wargo. We continue our look at men's health with a disease that most men really don't like to talk about, much less take steps to potentially identify whether they have it. Each year, more than 200,000 men are diagnosed with prostate cancer, and about 13% will die from it. According to doctors, prostate cancer is a very treatable disease when caught early on, but regular screenings are necessary.
The screening that's available for prostate cancer specifically includes a digital rectal examination, or DRE. This is the prostate check. This is the part of the examination that most men are not genuinely looking forward to, mostly because they remember it differently than how it actually occurs. It's a 5-second test. It's genuinely no more invasive than listening to somebody's heart or lungs. The other more commonly known test is a PSA. It's a blood draw, and a blood draw is very easy.
Dr. Fountain says there really are no symptoms that appear with prostate cancer, which is why screening is necessary. If diagnosed with prostate cancer, the patient and his physician will decide the best course of treatment, which may be minimally invasive surgery, radiation therapy, or no treatment at all.
Radiation therapy for prostate cancer is really a straightforward process. They'll walk right in, get changed into a gown, go back to the treatment room, lie on the table, hold perfectly still for about 10-15 minutes. We'll take our images, make the shifts in the table. The machine will revolve around them and give them the radiation. Then they can get up and go home. They can go play golf, they can work, they can do all the things they normally do.
Doctors say the side effects and complications of radiation therapy and surgery are the same for prostate cancer patients. What's most important is catching it early on, because then you'll have more options for intervention.
Men should not postpone a trip to the urologist or the primary care doctor to start the screening process. A digital rectal examination takes but a few seconds, and a PSA blood draw can usually be worked in with the same blood draw to check the liver function, kidney function, and blood count, part of the annual physical examination.
Once again, a healthy lifestyle contributes to the prevention of prostate cancer and other diseases. In fact, watching your weight, exercising regularly, drinking lots of water, all contribute to a healthy prostate. Of course, eating a balanced diet is important, but did you know certain foods may give you an added boost in prostate health? We recently visited the Conry Creation Health Center with local experts Stephanie Bassett and Chef Dave Atkinson to learn more. They say the way to a man's heart is through his stomach. So here at Waterman Wellness, we've brought in registered dietitian Stephanie Bassett and executive chef Dave Atkinson to cook us up something not only delicious, but nutritious. So Stephanie, what are we making today?
We're making a wonderful chilled tomato gazpacho. You have a wonderful antioxidant called lycopene, which is great for men's health. It helps protect against prostate cancer. Actually, processed tomatoes have the most concentrated source of lycopene.
Oh, so if you can't find fresh tomatoes, you can actually get canned tomatoes.
You sure can.
And
yes, you
it's
can.
actually better for you?
Yeah, it has more lycopene that way.
Go figure. Let's bring in Chef Dave and let's get this underway.
Good afternoon, ladies.
Hey.
How are we doing today?
I'm excited about this. So what do we have?
This is a real simple soup, and the good part about it is it's a chilled soup. So for the Florida heat in the summertime, it's all fresh ingredients. It's nice and cool, cleanses your palate.
And it looks like it's something that's easy to just grab and go. So sometimes, men will skip meals, and this way you don't have to. It's already ready. You make it up ahead of time. And
It's pretty much a one-pot meal. You dump it in the blender, you turn it on, blend it up, and pour it in a bowl, and you're good to go.
Awesome. So what exactly do we have here?
We have vegetable juice, diced tomatoes, diced cucumbers, roasted red peppers, chopped garlic, green onions for garnish. We have red wine vinegar, salt and pepper, jalapeno pepper, and a little bit of olive oil. So it couldn't be simpler.
Well, it smells delicious. So Chef Dave, we'll leave you to it. We'll check back in with you momentarily. So Stephanie, how many servings does this recipe make?
This recipe makes 4 8-ounce servings.
Okay, and this is something so then you can make ahead of time. And how long can you keep it in the fridge?
About 3 days. You want to make sure to keep it in an airtight container. Yep, very simple, very easy to make, and very tasty.
All right, I can't wait to taste it. Let's see how Chef's doing.
So our chilled soup is now ready to go. Nice and cool. We'll put a little green onion on top.
Ready?
That's delicious.
That's really good. It's got a nice fresh flavor and it's like salsa, but
Yep.
Well, thank you both for coming in and teaching me how to make a delicious soup without actually cooking. And I'm just gonna take this. Thank you. You'll find the entire tomato gazpacho recipe online at watermanwellness.com. You can learn more delicious recipes by joining the Yum Yum Club. The next class will be held Tuesday, June 24th from 6 to 8 p.m. at the Connery Creation Health Demonstration Kitchen. Call the number on your screen or visit connerycreationhealth.com for more information. Perhaps you know a teenager interested in starting a babysitting business. Like any other career, they should have the right training. 2 Safe Sitter training courses will be offered to the public this summer. The 2-day course, which is open to students age 11 to 13, will teach students to confidently and safely care for themselves and younger children when an adult isn't around. Students will learn important safety techniques such as CPR, how to apply first aid, and how to react in the event of a medical emergency. Additionally, participants leave the course with important life skills like organizational skills, handling money, and much more.
What we actually give them, in addition to the life experience skills, is that on graduation, they get a Safe Sitter backpack. It is filled with all kinds of activities that kids can use in babysitting jobs, including how to set up babysitting as a business, how to take care of children, how to keep the kids occupied, games that they could do with the children, little guidelines.
The 2-day Safe Sitter classes will be offered June 12th and 13th, and again on June 26th and 27th. Tuition is $75, and you can get more information or register by calling 253-3391. The summer months often provide opportunity for families to reunite while the kids are out of school. Adult children who are visiting with elderly parents can use this vacation time to make sure their loved one's environment is safe. According to Cheryl Coleman Brooks, a patient case coordinator with Florida Hospital Waterman's home care services, seniors living in their own homes without assistance might not be aware of possible hazards that exist year-round or when grandchildren are visiting.
We'd like to ask any caregivers to help make that place safe for their loved ones. And if that involves toys and sometimes a little bit of clutter, because they've gotten common with having things just at their handiness right next to them, kind of nesting in their chairs.
Coleman Brooks also suggests that the home be checked for low light to make sure the loved one can see well enough to move around his or her home. We hope you've enjoyed this month's Waterman Wellness, your path to healthy living with help from local experts. Be sure to watch for the July episode right here on Lake Sumter TV for some of the following stories. We'll show Florida Hospital Waterman's new equipment that treats a condition affecting more than 4 million Americans. Feeling thirsty? Reaching for a fork may be as beneficial as a glass of water. We'll explain. And we'll have advice on staying active despite painful joints. Those stories and more in the July episode of Waterman Wellness. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Michelle Wargo for Waterman Wellness.